Hi everyone, Joyce Griggs here for United States of Healthcare. And I want to talk to you today about two things actually. One of them has to do with searching for things, and then another one has to do with the pharmacist. So it was probably a month ago now, I woke up in the middle of the night and I had this horrible pain in my upper abdomen, right in the rib area. And at first I thought it was hunger pains, and so I got up in the middle of the night, had a little yogurt, and it kind of kept on. And so I woke up in the morning and I really was really uncomfortable. So of course I did what we all do, is I grabbed the phone and threw in, now I didn't go to one of the AIs, I just went straight into Google and I put in a search about, upper abdomen pain. What could that be? And so as we all know now, Google throws up their AI results for that first before they give you all of the search results. And of course, their AI is telling me that I have pancreatitis, gastritis. I must immediately go to an emergency room. I mean, it was like a 5-alarm fire. And so I kind of smiled to myself, even in my distress, and I was like, this is ridiculous. And this is what happens with, now that was like an extreme example of what happens when it gives you inappropriate information. So I just want to say, be careful when you're using these learning models to do these searches and they start sending you back things and making assumptions. They make a lot of assumptions. Just be really careful. So I scroll along and I find, a link to the Cleveland Clinic answering the question. So here's my tip to you, is that you really want to look for these bona fide sources when you're asking questions, medical questions online. Cleveland Clinic, Mayo Clinic, WebMD, those are the three that I look to the most for. At least I know it's going to be a level-headed, complete answer to my question, so that I at least have a sense of what's going on, as opposed to what can happen sometimes with the AI models. Unless you really give it guardrails, and I'm going to do a post about that, it can go sideways. Okay, so those are just some tips. Now, this is a long story. So it tells me, I can't remember what Cleveland Clinic exactly said, but I know that I need, guys, I know I need to go and do something about this because I'm in a lot of pain. So I drag myself out of bed and I walk to the pharmacy. The pharmacist is your best friend, folks, when it comes to questions about your healthcare. They are the most available healthcare provider that we have, and I have had amazing conversations with pharmacists in the US, in Greece, in the Atlas Mountains, in Morocco, and in Spain. I mean, there have been situations, I can recall them vividly, and I remember the faces of these pharmacists who helped me. So I went and spoke to the pharmacist about my symptoms. She said, it could be a few things. She made a few recommendations. I wound up taking 3 things. Now she was like, wait, you should only take one at a time. I said, look, I don't know if I could drag myself back here again if one of these things doesn't work. So we decided on the thing we thought was the number one that I should do. In my conversation with the pharmacist, I took the products, and all over-the-counter products, they would be considered over-the-counter in the United States as well. And I came home and I used the first one and it worked almost instantly, and I had relief. And it was, it's so embarrassing, but it was just really, really bad gas pains in my upper abdomen. So all I'm saying is, number one, careful with the search, because, according to that search, I was basically, had 2 weeks to live. And number two, pharmacists and questions. If you're, having questions about, something that you're going to purchase over the counter for something, talk to the pharmacist. They will give you great tips. And of course, always ask your pharmacist to explain your prescriptions to you, even if you're pretty sure you know what the side effects would be or anything else that you need to look out for.